So we can open it up for some questions from the committee. Dr. Carter, want to go first?
This question is to follow up what you were just saying about fathers. So in our group prenatal care sessions, it's really easy to engage fathers. They're invited to come. But in the traditional prenatal care setting, how would you recommend more actively engaging fathers in an obstetric practice?
So we're actually trying to get, I think we're going to have funding. I was hoping you had it just now. We're very close. We're actually trying to use the gestational, the GTT. There's a long visit and to use that as a family visit to encourage men to come during that visit. And actually, in the health centers, many of the men actually already are patients. But not of the obstetrician, but to bring men in to have a specific visit where we're encouraging. We call it a family visit, to encourage them to come in to do depression. It's easy to do depression screening, to talk to them, hear what their needs are, to provide services. So we're trying to break into what's a pretty, as you know, it's a very traditional set of visits. And you only have 15 minutes, so the longer visits seem like a more obvious time to start thinking about it. So that's how you have to start somewhere. We're going to try it. We know that there are barriers to guys coming in, but we also know there's a lot of barriers also from some obstetricians, and some of the obstetric nurses are tremendously supportive, and some are very resistant to change. As I said to you at lunch, the obstetric community has been slower than the pediatric community to figure out how to make social determinants part of their work. Fathers, I see, as one element of that kind of thing. I'm not sure that answered it completely, but you got to try something. So that's what we're thinking of trying. You could also think about men's set of prenatal visits. Inviting them for one time in a group prenatal care is good, but I don't think it's good enough. Sorry, someone else.
Dr. Levitt and then Dr. Parker.
So Neil. So you talked about adaptive communities, which is really an interesting concept, and mentioned the role of communities themselves, or people within the communities who are part of the process of even making decisions or being part of the process of adapting these processes which support plasticity and change. So who within the communities are being engaged to be part of that process, and do those individuals or those groups vary depending upon where you are geographically? You showed a map, I think, or where there's a lot of different communities involved, and I could imagine the adaptive complexity in Los Angeles is different than the adaptive complexity in Duluth, Minnesota. So who in the communities are being engaged, and how do you identify them, and how are they being engaged?
Can you hear me okay?
Yes.
Oh, all right. I think the point, I'm glad you picked up on the point. We're interested in being able to help children adapt, families adapt, so communities have to be able to adapt. And so there's a whole set of adaptive tools and processes that can be used. And it's different in all different places. So that, let me take Hartford, Connecticut, for example. Hartford, Connecticut was one of the richest cities in the United States 100 years ago. It's now one of the poorest cities in the United States. It has some 23 or so neighborhoods. And the Hartford Foundation there, which is what we're starting to see is in many communities, it's the community foundation that is there and is part of that community and has a long-term stake, has been supporting processes of helping neighborhoods take their data on their children, and so to say, okay, how do we deal with this? What do we do to change things? And having community cafes in which community members come together and begin to work on what kinds of changes do they want to make in the community. in Cincinnati, I don't know if Rob talked about the design process that they used in Cincinnati to begin to launch their All Children Thrive, but it was a user-centered design in which families, members, mothers and fathers were engaged in actually co-creating the kinds of changes and solutions that needed to happen. So there are a whole variety of ways, but there's some kind of principles that you use to begin to engage families, and it is different in all those different places. That's why you need an adaptive toolkit that you can adapt, that works in whether it's in Hartford or Cincinnati or Watsonville, California. What's interesting to me, just one other point, when we started to bring a bunch of the communities together a year ago, this August in Cincinnati, we brought 16 communities to Cincinnati to talk about how they would work on this All Children Thrive effort. There were teams from Washington, D.C., New York, Watsonville. What was really interesting as we went around the room is that the problems that places were facing, whether it was New York City and George Askew, the head of MCH, talking about the problems that were faced by children in New York City, or it was Dori Rosinda, who was talking about Watsonville, California, which is a farm worker town on the central coast of California. People said was they were facing exactly the same problems, whether it's in New York City or in Watsonville. There's the same sort of issues with employment and families, with violence, with racism, with all those same kind of social issues, but the same kind of challenges that families are providing health care and child care and support when they don't have enough time, they don't have services, they don't have supports, and they don't have resources. And so this is a universal problem. And back to Milt's point about social strategies, if you look at, and just to this group where I think Nuanced Neighborhoods maybe failed in sort of recognizing the importance, or at least taking it far enough, if you look at the countries around the world whose children are thriving or doing much better than our children are in early childhood, what you see is that they have an approach that basically utilizes at least 3 social strategies. One is healthcare, and healthcare is one that we accept here in our country. The second is early childhood education. Most places have early childhood education. We're the lowest, or close to the lowest, of all developed OECD countries in providing that, right down at the bottom. But we still believe that education is an acceptable social strategy. But the third that all countries have is family support. And they recognize that all families need support. And what we don't have is a social strategy for family support. We provide support to families once they've failed. We pay for failure, we don't invest in the success of families. And my argument is that given the changes we're facing, that the real adaptive challenge is helping families really respond to this new world that they're facing and begin to provide that. And I think strategically what we need to be thinking about is progressive universalism and family strategies in which we're providing universal family supports to all and making that normative in terms of what we do. So my point is that, yes, you customize to bring families in and do it in each place differently, but they're facing the same kinds of issues. And there's some universals that we need to be thinking about. And one of those is really dealing with the really lack of a social strategy that supports families, whether it's fathers or mothers or the whole shebang. It's just lacking in this country.
Can I just add a comment? So my proposal for Title 23 is actually the same thing that, Neil, you're talking about. We would have a legal framework in the United States to deal with some of the changing complexities, but it is child and family support, which is what the Europeans, which is why I spent that time in the beginning explaining why we had this fight 100 years ago. Otherwise, it's an interesting fight, but it set us on different historical paths. We are not living in an ahistorical time. So I want to say two last thoughts, because one is, we talk about social determinants and we forget to say that there are powerful interests in this country that like the system that we have. That's the, some things we can really make a difference, but we should be realistic politically. That's what we have to figure out, how to make progress in this era. There are forces that really like the way the world is, and we need to know that. The second thing is I did want to just be very specific on I wanted to highlight something in Rob's work that I thought was really interesting. His was the only group that actually talked about perinatal, and he had a success. And if you didn't note a particular two items that he said, one is that he required that in his area, by 18 weeks, anybody who had a social need, 90% of them had to receive some response to their social need. That was a very tight relationship between the health and social needs section. So if we're going to think about it, so just adding a social worker to OB is a good, how can OB take a more active role in dealing with social determinants? There was an example where there was a linkage. Now, it isn't that perfectly obvious whether every other place can do that, but the second part of your thing was that you set up a legal, the legal system essentially in the obstetric unit, if I heard you right at lunchtime. That's, again, another way in which you bring these sectors. You have to, when you figure out that's what you're trying to do in that kind of model, what programs can you do that link those sectors really tightly? Because in the end, unless we adjust all three of those sectors, we're gonna have some problems.
So no, we're running long. Can we have at least one more question? Oh, okay, great. All right. So Dr. Parker, you're next.
Thank you. I was wondering if you've looked at rurality as a factor in your work. I know that a lot of the programs that we've talked about over the day have been centered within cities and urban areas in general. And the work that I do is in American Indian Alaska Native communities. And I know that there's a lot of other communities out there in rural settings that also experience many of the factors that you're talking about. There's also this element of rurality that isn't necessarily addressed by a particular program that might be rolled out at the national level or even the state level.
I'll give a quick answer. Maybe Neil has something to say. So I take that as it's an equity issue, and it's also a social strategy issue. I think when I look at prenatal care, home visiting, I often think, where are we delivering services? Are there creative ways of delivering services to rural communities? And can we increase the capacity to do that? It's not the easiest thing. I don't know where you're from, but I know in Alaska, they fly in people from the really rural towns, and they basically sit and wait in Anchorage until they deliver. That's not the greatest thing for having a healthy baby, but maybe it's, but again, I see it as a social strategy issue, and I encourage you, as you write this, you might find this framework helpful to say there's some knowledge issues that you have to solve. Neil actually gave some great examples in the data side of how powerful. So I think the rural it's a social strategy issue. How can you deal with it? That's how I think about it.
Anything to add, Dr. Hoffman? No.
I think from this kind of complex adaptive system, you're mapping your rural system base. It's a unique kinds of system, so you'll sort of look at the forces, how it works, and figure the leverage points that you're going to use in that system to make the kind of changes that need to happen. So, where are you trying to get to? What would 10 years out, 20 years out, what would an ideal system start to look like? What do you have to re-engineer and transform? What's the pathway forward? How do you sort of move that process? But it's just customized to that environment. It's just a different ecosystem. Just one point I do want to make is I would really encourage you to move beyond the social determinants kinds of framing. I know that's all in vogue right now. I think it's very what I would call 2.0. It doesn't really, it sort of looks at social determinants all in an isolated way. I think what you're really trying to look at in terms of early childhood development is the ecosystem, and all the social determinants are embedded. They're multi-level. The IOM report on children's health that came out in 2004, and the Children's Health, the Nation's Wealth. The model in there is an ecosystem model. It's more 3.0 rather than 2.0. And I think, we're still stuck on a biopsychosocial model that's being defined by the medical system. So we say social determinants because we make it different than biological determinants, when in fact, from a life course or health development or adaptive systems, EVO-DEVO, it's really about the ecosystem, and these social, cultural forces are all embedded in that. And so I think, we need to sort of move beyond that kind of way of thinking, even though I know it's, finally after 40 years, it's become in vogue.
Thank you. Dr. Pear.
Neil, hope you heal up well.
Yeah, thanks.
So two quick questions. One is, does housing come in much in your thinking around the ecosystem? And two, do you look upon the EDI as sort of a galvanizing strategy for communities?
Housing does come up, and that's kind of the social determinant du jour right now, largely because of the homeless and the cost of housing. So we've been able to really provide really good examples in a healthcare system and a health policy that only thinks about cost. You can pick the social determinant of housing and show that, it costs an emergency room X gazillion dollars a year in hospitals because of housing. So it's a really good one to pick on and move forward. But I think housing is really important for kids. I'm actually in a meeting later this week with people from the Federal Reserve Bank and Community Development about how do you begin to think about housing, but not housing in isolation. What we're really thinking about is sort of how do you build the cities of the future, so that you're thinking about housing, childcare, mixed use. It's really how do you create environments for kids. And that's, I think, what we're moving towards. And so, there's a movement called 880 cities. How do you create cities for 8-year-olds and 80-year-olds? And if you do it that way, it sort of works for everybody. And so I think we need to be thinking about those kinds of design their functions. As far as the EDI goes, I'm watching, when I learned about the EDI close to 20 years ago, when we had a meeting at the sort of right after Neurons to Neighborhoods came out, we had a meeting in Los Angeles with teams from the U.S., Canada, Australia, and the U.K., and the EDI was presented by the folks from Canada. I said, Roy, that this is a disruptive way of measuring things, because you're measuring things neighborhood by neighborhood. You can have an equity measure of disparities at a neighborhood level. That changes the whole game. You can't run away from it at that point. And in fact, that's what we're seeing in the communities that actually can activate the EDI and use it. It's galvanizing. It creates a common metric. And that three-tiered kind of complex system I showed you, the city, the community, the provider, and the parent, it's actually a 4-level. What we're seeing now is that in some communities, all 4 levels are looking at a EDI. And so what happens is you have a common measure using for all 4 levels, and that takes data and not just turns it into information that's used at all the levels, but it's creating currency or current that's flowing through the system. It has value to everyone, so it allows them to align and move and align their stuff together. And what's really important to recognize is the EDI is just the beginning, because what you really want to measure if we move forward is trajectories. You don't want cross-sectional measures at one point in time. You want to be able to measure trajectories. And now with the EDI and the MDI, which is the Middle Development Index that's done at 9 and 11-year-olds, and there's going to be a Toddler Development Index, the Canadians now have trajectory measures. And in Vancouver, they're linking all these measures with medical record, administrative data, and census data, so that they get a 360 view of all their children at a neighborhood level. It is mind-blowing when you sort of move in that direction. Completely changes the game in terms of how. So if you're interested in moving beyond isolated social determinants, you can actually start to map the ecosystem and the dynamics in the ecosystem from a life course developmental way. And that's where we should be shooting for. And this isn't just pipe dreams, pie in the sky. They're doing it already. And we're starting to talk with San Jose about it and Santa Clara, because they've created a data trust and a data zone there. They're actually doing that in Montgomery County, and I think they could be doing it in Washington, D.C., where you have EDI and various other things. So the data systems of the future are right around the corner, and that's where you should be designing to move in that direction so that you can begin to galvanize and people start seeing themselves differently, see their community differently, see their neighbors differently, and see the future differently.
All right, I think we have time for one more, Dr. Liu.
So yeah, I'm actually really intrigued by Neil, what you said about the social strategy for family support, and Milt, what you said about Title 23. So I'm wondering if you were to translate what you said into a political platform for the next administration, what would be the key components of that platform?
Well, in some ways, I'm going to violate what Neil just said and think old style rather than new style. But, you know, we have paid leave as the most obvious part of that campaign. Childhood allowances, that's where you really are headed towards, trying to give supports for family and probably if you're really thinking about doing something in that the social welfare side. So it's paid leave, it's family and child supports. Those are the kind of things that you would have in that sector of activities. I mean, I can work with you on a few other possibilities, but I also think a nursing benefit for families, the maternity leave activities, not just the pregnancy leave, but sick leave for families. Those would all fit in that kind of sector. I actually, though, like Neil's view of thinking more distantly, but I think we haven't accomplished in 100 years what we started out. So I'm trying to be practical without things. But I do think, in fact, it is a possible platform. You could use that as a platform. I think Social Security is a very powerful tool. I told Obama, I told the Obama administration, I thought they really missed the boat in not making Obamacare Title 22. I think it would have served him much better politically in the long run had he actually thought a little bit about the power of some of these things. This is what actually defines our health and welfare system. And I do also want to say, I really want to agree with Neil on this issue of databases. I do think what we measure is really important, and there's a lot of creativity and measurement that we're able to do right now, and I think that carries over and does cause political will, those arrows in this little model. So,
Dr. Hoffman?
I don't really have anything to add other than I think the action for the near future is going to be at the local level, not at the national level. I know you're sitting there in Washington, D.C., but what's driving the world right now is beyond sort of, I think, what Washington's going to control right now. And I think that for the next 10 years, where we're going to see the biggest progress is going to be at local levels and at the city level, because cities are the place that control the social determinants of health, parks and rec and schools and transportation and housing and all that are all city level stuff. And cities are able to move fast enough and make change fast enough. And I think we really need to spur an innovation revolution for early childhood in the country. Because things are moving too fast and we're not moving fast enough to make that happen. So if I was going to create a platform, it would really focus on stuff that can be done to turn cities loose and to create the opportunities for them to sort of be as creative as possible, to innovate, and to really create the kind of learning platform. That's what we're trying to do with All Children Thrive.
So one quick last word.
Yeah, just Best Baby Zone was an effort to go even deeper into communities, was to actually reach into like small neighborhoods and try essentially to organize in small neighborhoods see if by going door to door, talking to people, hearing what their needs are, seeing if you could bring groups of people together to try, because I sort of believe that if you have agency, if one person has agency, if you've got two people with agency, you start actually having the possibility of creating some kind of movement to force change in some of these other sectors. So I was trying to think, is there opportunities in our world to think politically in a sort of different way? I have to be honest, I don't think you can actually make all the difference in the world if you're doing in 4 square or 8 square blocks in the poorest sections of cities in America and change the social determinants of our country. But I think people learned a lot from that experience at that level. Neil is correct that there is a lot of action taking place at cities and states. I think that's because, we don't, so I'm not in the government, I can say this, we don't have much control of the national government at this moment. If we did, we might actually not be arguing to do such local initiatives, although Neil might actually argue to do it locally, because I do think that's where the creativity is. But I think we have to be political at each of these levels and be conscious about it and try to bring the reproductive health world and the child development world into that process to link to people's real needs and make that part of their political process and have them help us in doing the work we're doing. You're going to have to work at all these levels. We all know this, but be more conscious of these different levels, I think, would help us move forward in a difficult time. Make progress where we can.
Well, thank you. Let's give a round of applause for our speakers. Thank you.